The university and Jewish hospital have been treating a fair number of COVID patients. Some folks get so sick that the ventilator is not enough to keep them alive. Their lungs get so stiff that the ventilator can't actually get enough oxygen into them and blow off enough carbon dioxide. And in that circumstance, then they basically need to be put on what's essentially cardiopulmonary bypass. It's called ECMO, a way of taking the blood out of somebody, running it through a machine that oxygenates it, and then putting it back into the body. And those are the folks that I take care of. A couple of people that we've had who've gotten better were on ECMO for about a month, so 4 weeks with their lungs completely turned off, just using the machine to keep them alive. And then once their lungs got better to the point that we could get them off of ECMO, then they had to be on the ventilator for a while still and before they got all the way better. The youngest person that we've had has been 29. The oldest was 63. It is as dramatic of a step as we can do to try to save somebody. And it really is the point of last resort. It's important that we have that capability in the community. This is something that I think separates big academic centers from kind of smaller community hospitals, is the ability to do these heroic gestures. Most of them we've put on within 24 to 48 hours of them being in the hospital. Some of them have been transferred from outside hospitals where they've been there, they've been on the vent and been kind of supported for a little while, and then when they finally realized that they were getting worse faster than they could deal with them, they sent them to us to take care of. But it does seem like most of the folks, when they really crash, they crash very quickly. They go from being okay to not okay at all. If you are taking care of somebody who is very sick on the ventilator and you're not making progress and you're at a point where you think that you may be starting to damage them, then please give us a call. And we may be able to help arrange for transportation for us to be able to take care of that person and see if ECMO would be appropriate for them or not.